Emotional intelligence and oral health behavior. Introduction. Stress is a complex psychobiology response, and dental students often face higher stress levels than their peers, negatively impacting their oral hygiene habits and overall well being. Research gap. Despite extensive studies on stress and emotional intelligence, the specific link between EI and oral health behavior in dental students remain unexplored, necessitating this investigation. Study objectives: understanding EI, stress, and oral health. Evaluate emotional intelligence. Assess the emotional intelligence level of dental students to understand its impact on their overall well being and stress management capabilities. Measured perceived stress. Determine the levels of perceived stress among dental students and how these stressors relate to their oral health behavior and hygiene practice. Correlate variables. Analyze the correlation between emotional intelligence, perceived stress, and oral health behavior to identify significant relationships that may influence dental student practice. Study design. This study utilized a cross sectional survey method at Down National Dental College, focusing on the relationship between emotional intelligence, perceived stress, and oral health behaviors among dental students. Survey instruments used in the survey. Socio-demographic questionnaire. This questionnaire gathered essential background information about participants, including age, gender, academic year, to better understand the demographics affecting emotional intelligence and oral health behaviors. Brief emotional intelligence scale. The brief emotional intelligence scale assess participants' emotional intelligence level, focusing on their abilities to recognize and manage emotions, which is crucial for understanding stress and oral health habits. Perceived stress scale. The PSS 4 evaluated participants' perceived stress, measuring how situations in their life are appraised as stressful, thus providing insights into the connection between stress and oral health behavior. Inclusion and exclusion criteria. Inclusion criteria. Participants must be an undergraduate dental student at DIDC, volunteering participating with informed consent to ensure ethical standards are maintained in the research process. Graduated professionals. Graduated dental professionals were excluded to ensure that the study sample reflects current undergraduate experiences, allowing for accurate assessment of current stress and health behavior. Exclusion criteria. Students from other health science programs were excluded to maintain a focused study population and minimize confounding variables in the relationship between EI, stress, and oral health. Questionnaire completeness. Incomplete or unresponsive questionnaires were excluded to uphold the integrity of the data collected, ensuring reliable results that accurately represent the target population's behavior and perception. Key findings on stress and oral health. Stress and oral hygiene. Higher perceived stress levels among dental students significantly correlate with poor oral hygiene habits. This suggests that managing stress is crucial for promoting healthier habits. Academic stress impact. Academic stress was closely linked to higher PSS 4 scores. These findings confirm that stress not only affects students' well being but also their ability to maintain proper oral health practice. Key findings on emotional intelligence. EI and oral health. A significant relationship exists between emotional intelligence and oral health behavior. With higher EI scores correlating to better oral hygiene practice, this highlights the crucial role of EI plays in promoting healthier habits among dental students. EI stress EI and stress levels. Students exhibiting high emotional intelligence reported lower levels of perceived stress. This suggests that enhancing EI could be a potential strategy to help dental students manage stress more effectively and maintain better overall health. Statistical overview. This section explores the correlation between emotional intelligence, perceived stress, and oral health behaviors, highlighting significant relationships and the overall impact on dental students' well being. Limitations. The study's findings are limited by the sample scope, lack of clinical examination, and focus solely on emotional intelligence, perceived stress, and oral health behavior. Single institution sample, absence of clinical oral examination, limited measurement tools, other factors such as sleep quality, academic burnout, personality traits, SES are not measured although they may influence results. Conclusion. Dental students with higher emotional intelligence showed healthier oral health behaviors, while those with higher perceived stress demonstrated poor habits. Academic stress aligned closely with standardized PSS 4 scores, confirming that stress meaningfully shapes both well being and behavior. Overall, stress and emotional intelligence emerged as key drivers of students' oral health choices.